Hi, I'm Mark Friedman, and I'm coming to you from Santa Fe, New Mexico. Glad to be with you. I'm the author of Trying Hard is Not Good Enough. And today we're going to be doing a shortened version of results-based accountability. The full version, of course, can be found in Trying Hard is Not Good Enough and the companion reader, Turning Curves. Results-based accountability starts with a fundamental distinction between two different kinds of accountability: population accountability and performance accountability. Population accountability is about the well-being of whole populations in a geographic area, all people in North Carolina, all children in North Carolina, all children in Raleigh. Performance accountability is about the well-being of customer populations and the performance of programs, agencies, and service systems. These are two profoundly different kinds of accountability. The first about partnerships across the community, the second about our role as managers in running programs and agencies and service systems. We're going to draw a sharp distinction between these. We're going to talk about how to do both of them well. Now, people have asked me for a simple way of remembering the basics of RBA, and we came up with this 2-3-7 mnemonic. There are two different kinds of accountability, which we just talked about, and there's a language discipline that goes with keeping these two kinds of accountability straight. Results and indicators for population accountability, performance measures for performance accountability. Results in this case, population results, are quality of life conditions like clean environment, safe communities, children ready for school, healthy people. And indicators are the measures that tell us whether we're getting those conditions or not. Performance measures, of course, tell us whether the programs are working or not. And there are three different kinds of performance measures in RBA. How much did we do? How well did we do it? Is anyone better off? And finally, there are 7 questions that will get you from ends to means, from talk to action in about an hour. And this is about baselines and turning the curve. Notice that there are 10 ideas in white on this page. And if we could just come to agreement about how to talk about our work with these 10 ideas, we would open up new opportunities for working across the silos in our service delivery system and across our communities. We're going to spend a little more time talking about common language. You've all seen this picture before, I'm sure. It's the biblical Tower of Babel. And this is the modern Tower of Babel. And you've seen all these words before: benchmark, outcome, result, goal, indicator, measure, objective, target. Then you get these modifiers in the middle: measurable, urgent, strategic, systemic, incremental. You can think about this page as the jargon construction kit. If you want to sound fancy about this work, you just pick 3 or 4 of these words and put them together. Measurable, urgent, systemic indicators, whatever the hell that means. Core, qualitative, strategic objectives. I guarantee if you do this, by the way, you'll get away with it because people will be too embarrassed to ask you what you mean. So we're going to spend some time working our way away from the Tower of Babel by using some clear definitions. We've already talked about population versus performance accountability. And now we're going to go on to the difference between results, indicators, and performance measures in a little bit more detail. Population results are conditions of well-being for children, adults, families, or communities. So for example, children born healthy, children ready for school, safe communities, clean environment, prosperous economy. Indicators, some places have called these benchmarks, are measures that help quantify the achievement of a result. So for example, the rate of low birth weight babies helps quantify children born healthy. The percentage of children ready at kindergarten entry helps quantify children ready for school. The crime rate helps quantify safe communities. The air quality index, clean environment, the unemployment rate, prosperous economy. So indicators quantify results at the population level. And at the performance measure, we have measures of how well a program, agency, or service system is working. And as we noted before, there are 3 different types of performance measures in RBA. How much did we do? How well did we do it? Is anyone better off? And I'll explain where they come from in a little bit. And that last category, the is anyone better off category, we sometimes refer to that as customer outcomes to distinguish it from population outcomes. I encourage you to take a look at the tool for choosing a common language. The latest version of this is in Turning Curves. But this is a tech tool that can help you as a group reach agreement on how you want to label ideas. Words, after all, are just labels for ideas. And so we start the first column with ideas, a condition of well-being for children, adults, families, and communities. And you have some choices about how you want to label that idea. You can call it a result, as we are today, population result, If you go to England and talk to your friends there, most of the communities in England use the word outcome for this idea. And you have modifiers here: population result, community-wide result, community-wide outcome. But in the last column, you record your choice. And the only rule here is that you can only use any one combination of words to label a particular idea. So we're going to go to now population accountability. And I want to share with you my favorite example of population outcomes, or in this case, community outcomes, from Cardiff in Wales in the UK. I have dozens of these, and if we had time, I'd show you some more. But this is now my favorite. People in Cardiff are healthy. Cardiff has a clean, attractive, and sustainable environment. People in Cardiff are safe and feel safe. Cardiff has a thriving and prosperous economy. People in Cardiff achieve their full potential. Cardiff is a great place to live, work, and play, and Cardiff has a fair, just, and inclusive society. And it's not too much of a stretch to think that you could replace the word Cardiff with North Carolina and have a beginning set of community outcomes or community results that could be used at the state level or in any of the 100 counties or cities. So people in North Carolina are healthy. North Carolina has a clean, attractive, and sustainable environment, and so forth. So consider this a possible beginning working list of population outcomes to use. Now, if you have a set of population outcomes or results, that enables you to produce a report card on quality of life. And I have lots of examples of report cards from Miami, Florida, Cardiff in Wales, Georgia, and of course, North Carolina. The North Carolina State Health Improvement Plan is a report card. Each of these report cards have results and indicators and enable people to make judgments about the quality of life in their communities, and using RBA, what to do about it, how to improve on any number of these quality of life conditions and their associated measures. I want to show you. It's all well and good to have a report card, but the report cards are not the end of the process. The report cards are actually the beginning of the process, because report cards allow you to assess what's going well and what's not going so well, and the things that you need to work on. And working on those things involves getting from talk to action. And I want to explain the RBA method of getting from talk to action using a method I first discovered in Tucson, Arizona, when I was working for the Arizona Department of Education. And I asked people if people there had had a leaking roof in their lives. Many people raised their hands, somewhat to my surprise. Now, this is usually a two-part conversation, but I'm going to have to play both parts in this case. So if you have a leaking roof, how do you know it's leaking? Well, water is dripping down from the ceiling, puddling on the floor. Water is not where it's supposed to be. So we experience the leaking roof in some pretty obvious kinds of ways. Now, if we wanted to measure how badly it was leaking, what could we do? Well, we could put a bucket out and measure inches of water in the bucket. And that's what this graph is. These are the last 3 rainstorms. And after the first rainstorm, we had a little more than an inch, and then a little more and a little bit more. Where do you think that line is headed if we don't do something about the roof? Well, the roof is not going to fix itself. And this is what we mean by a baseline. A baseline in RBA has 2 parts. There's a history part that says where we've been the last 3 rainstorms, and it has a forecast part that says where are we headed if we don't do something more or different than what we're doing now. Now, if you're living in this household, that future is not okay. You want to follow a path to 0 just as fast as you can. And this is the concept of turning the curve away from the baseline, or beating the baseline. Now, what's the first thing you have to do when you have a leaking roof? Well, first thing you have to do is find the leak. And that's what we call the story behind the baseline. What are the causes and forces at work? Now, let's think about partners who might be able to help you. Lots of partners, the hardware store, neighbor with a ladder, your brother-in-law. Lots of people might be able to help you fix the roof. What are your choices about how to fix the roof? What works to fix the roof? Well, you have 2 big choices, repair or replace, or you could move somewhere else and sell the house. But when it comes to repairing the roof, you also have more choices: tar, tile, duct tape. So that leads us then to the idea of an action plan. Your brother-in-law comes over to help you fix the roof. We get up on the roof, we fix it, we implement this action plan, and then what do? Well, we wait for the next rainstorm. What happens if after the next rainstorm, inches of water in the bucket is here? Is the roof fixed? Well, no, it's not. And so what do you do now? Well, you've got to go back through this process again. You missed the leak the first time, or maybe there were 2 leaks, but you only found one of them. We think about partners again. Well, we now know that my brother-in-law doesn't know anything about fixing roofs. We think about what works. Well, maybe duct tape wasn't the best choice of patching material, and we create a second action plan. And then what do? We wait for the next rainstorm. This is an iterative or repetitive thinking process until there's no more water in the bucket. This is the thinking process behind RBA. Very simple. You'll find that it plays out through both population accountability and performance accountability. And I would ask you to think, how many of you could explain this one page to another person? Because if you can and you get lost in this work, you can come back to this page and it'll help you figure out where you are. This way of thinking about getting from talk to action for population accountability plays out in the form of 7 questions. Question number 1, what are the quality of life conditions we want for children, adults, families who live in our community? And this is what we've been referring to as population results or outcomes. What would these conditions look like if we could see them or hear them or feel them? And this is the experiential version of the quality of life conditions. How can we measure these conditions? And these are the indicators that tell us whether we're achieving the results or things are getting better or worse. How are we doing on the most important of these measures? The most important of these measures part signifies a willingness to winnow down to the 3 to 5 most important measures. And the how are we doing part is about creating baselines for each of those most important measures and telling the story behind the baseline. Who are the partners that have a role to play in doing better? What works to do better, including no cost and low cost ideas, very important. And finally, what do we propose to actually do? These 7 questions will get you from talk to action at the population level. And there's an exercise version of this that I strongly encourage you to take a look at. It's in Trying Hard is Not Good Enough, Appendix E. There are turn the curve exercise instructions, both at the population and performance level. So I want to share with you some examples of where this kind of thinking has actually worked. And this is one of my favorite examples, Mothers Against Drunk Driving. And this is a picture of alcohol-related traffic fatalities from 1975 to 2010. I've only updated it to 2010. I have to do more work to update this again, but Mothers Against Drunk Driving was formed in 1981, a group of women who got together in the back of a restaurant outside Sacramento, California, after decades of growth in this measure. Each of them had a family member who had been killed by a drunk driver. Now, one of the things I like best about Mothers Against Drunk Driving is they don't claim sole credit for this. They know they have had a lot of partners, a lot of pieces to their strategy, everything from the prom night pledge to designated drivers, lots of partners and improvements in car safety and other things. But together as a country, we have actually turned this curve. We went from 75 people a day dying on US roads from alcohol-related traffic crashes to 45 people in 2005, down to 28 people per day in 2010. Now, does anybody think 28 people a day dying on US roads is okay? Well, no. As with all of these baselines that I'm going to be showing you, there's going to be a lot of room for further improvement. But here's a curve that we actually turned. So our next example involves another public health matter, teen pregnancy, and you might be interested in this quote from the floor of the Colorado legislature. Statistics show that teen pregnancy drops off significantly after age 25. Very surprising. So the next story is about teen pregnancy rates in Tillamook County, Oregon. And this is a chart showing those rates between 1990 and 94. And I realize these are old stories, but this accomplishment was also achieved using RBA. Back in the early 90s, the state of Oregon issued a report card comparing the 36 counties in Oregon on their teen pregnancy rates. Tillamook County turned out to be 3rd worst on this list. It came as a shock to the people who lived there. They didn't realize they had a problem, certainly not that bad compared to their neighbors. So what happened about that time was there was a proposal on the table to build health clinics in the high schools in Tillamook County. Now, this is a very conservative county, both politically and socially, and they didn't want health clinics in their high schools. They didn't think it was any business of the schools to be promoting health services. We could debate that, of course. But they turned the question around. They said, okay, we're not going to have health clinics in our high schools, but what are we going to do about our problem with teen pregnancy? Notice the phrasing of that. What are we going to do about our problem? One by one, different groups came forward to be part of this work. The schools weren't going to get new health clinics, but they could retool the way they use their nurses and other health professionals to focus on work with adolescents on matters of sexuality. The churches wanted to be part of this work. Now, they were not about to turn over their money to government, but they that sponsored supervised recreation between the hours of 3 and 6, which is when we know a lot of kids get into trouble. The health department looked at its policies. They discovered that if a teenager came in and asked for an appointment, they got an appointment 2 weeks later. If any of you have teenagers, you know that doesn't work very well. So the combination of all these efforts together produced a pretty dramatic improvement from third worst to best in Oregon in teen pregnancy rates in Tillamook County. Now, there's another part to this story, which is that a couple of years later, this went back up, almost halfway back up to where it had been. And that's typical of the problems that we think we've solved and we go on to the next thing. Tillamook County officials decided that teen pregnancy was the old administration's concern. And one of the lessons of this is that if you're going to make progress on important indicators like this, you need a strategy to keep people together to maintain that progress once it's made. This is a story I won't go into in detail, but this comes from Newcastle, England, home of one of my favorite beers, Newcastle Brown Ale. And this is a picture of not in education and employment or training for 16 to 18-year-olds. This number ranged between 15 and 17% for a long time. The woman who ran this council came to one of our trainings in the north of England, went back, and their combined work produced a dramatic reduction in the percentage of 16 to 18-year-olds who were not in education, employment, or training. And of course, we have examples in North Carolina, and this is just one of several examples that was provided to me about progress you all have made in youth tobacco use, specifically in Cleveland County in this case, but I suspect there are similar charts in other counties. And this was a consequence of a partnership between at least 10 different health and education organizations, and a strategy that delivered a range of early intervention and diversion programs, developed and implemented a comprehensive tobacco messaging program, and worked with school nurses to refer students to age-appropriate tobacco cessation programs. So again, a complex strategy involving many partners that produced a significant reduction in youth tobacco use, with obviously a long way still to go. We're now going to turn our attention to the second half of RBA, which is performance accountability. And I want to explain to you where the performance measurement categories in RBA come from. How much did we do? How well did we do it? Is anyone better off? And it comes from the intersection of two sets of questions. The first, quantity versus quality. How much did we do versus how well did we do it? Crossed against these two dimensions of the work itself: effort, how hard did we try? And effect, is anyone better off as a consequence of our trying? A lot of discussion in this kind of work stops at effort. How hard did we try? We're pushing the discussion further to see if it actually made a difference in people's lives. And you combine these two perspectives, and you get a 4-quadrant picture of quantity of effort, which is how much service did we deliver; quality of effort, how well did we deliver that service; and then how much change or effect did we produce, and more importantly, what was the quality of that change or effect. And these 4 questions collapse into these 3. How much did we do? How well did we do it? Is anyone better off, number and percent? So let me give you a couple of quick examples of what this looks like. And we start with education. How much did we do can be measured by number of students, number of teachers, hours of instruction, dollars spent, lots of other measures, but number of students we'll stay with. Now, how well did we do it? The student-teacher ratio, 20 to 1 is better than 30 to 1. But is anyone better off can be measured in part by the number of students who graduate from high school, and more importantly, the percentage of those who graduate from high school. But we could push ourselves a little harder in the education community by asking, what was the number and percentage of 9th graders who graduated on time 4 years later and entered college or employment after graduation? That would be a tougher measure of the effect we have on young people's lives. Here's a typical pediatric practice. How much did we do? Number of children treated. How well did we do it? Percentage of patients waiting perhaps less than 30 minutes in the waiting room. But one of the important measures would be something like the number and percentage of children who are fully immunized in the practice, in the pediatric practice, not in the whole community. The percent immunized in the whole community is a population indicator. And here we have instead a performance measure for the pediatric practice. Here's a typical drug and alcohol treatment program. How much did we do? Number of persons treated. How well did we do it? Perhaps the percentage of staff with advanced training and certification. But what you really want to know if you're running such a program is the number, and more importantly, the percentage of clients who are actually off of alcohol and drugs at program exit 12 months later, if you can contact them. This in the lower right quadrant is what's more important because it tells us whether we've made a difference in people's lives. And it's not just health, education, and social services. Here's the fire department. I have these slides for many, many different services. But how much did we do? Number of times we responded to an alarm. How well did we do it? Response time. We know 3 minutes is better than 3 hours. But here's a measure that fire departments around the world are actually using, the number and percentage of fires that are kept to the room of origin. And if you think about it, who are the customers of the fire department? And one answer to that is people whose buildings are on fire. And here's a measure that helps us identify the extent to which we've been able to contain the damage to those buildings. And it's not just public services, but here's General Motors. I took these examples from an article in USA Today many years ago where they interviewed the chief executive officers of the big US car companies. And I went through the article and identified where these people had talked about their performance using data. Not a single one of them talked about production hours or how much steel they used. One of them talked about a typical efficiency measure, employees per vehicle produced, because it took their company more people on average to make a car than their competitors. They were kind of worried about that. But all three of the executives talked about some version of this lower right quadrant: market share, profit per share, and car value after 2 years as a percent of purchase price, because they were concerned about two very different groups. First of all, their shareholders, of course, and secondly, their customers. So why in the world would you want to sort performance measures for your program or service into these categories? And the answer to that question is really quite simple. These categories are not equally important. This upper left quadrant, where we count how much service we delivered, is not unimportant, but it's the least important of the performance measures. The most important performance measures are the percentage versions of whether we've made a difference in people's lives or not, and also of great importance, whether we're doing a good job delivering quality services, which is the upper right quadrant. We're going to take our most important performance measures from these two quadrants. I want to turn our attention now to the matter of control, because it turns out that as you go from the upper left quadrant to the lower right quadrant, first of all, you have less and less data. It's much easier to get data on how many people you serve than it is to get data on whether they're better off or not. But it also is true that you have progressively less and less control over how good you look on that data. And the classic example here is recidivism rates for adult and juvenile corrections facilities. And I get some corrections officials who bristle at being held accountable for recidivism rates, because it has a lot more to do with things that happened outside the facility than anything that ever happened inside the facility. I would argue that recidivism rates are perfectly legitimate lower right quadrant performance measures for corrections programs, but if you want to look good on those measures, you better be working with the people outside the walls of your jail or prison if you want to look good on recidivism rates. Hospitals better be working with the people outside the walls of the hospital if they want to look good on patient recovery. Schools better be working with people outside the walls of the school building if they want to look good on student performance. I get some people who say, if I don't control it 100%, it's not a valid measure of my program. Have any of you folks ever said that? Well, I ask you, think of one thing, anything in your personal or professional lives that you control 100%. The best answer I ever got to this question was my goldfish. I had some guy who thought of himself as God to his goldfish. But I had little kids. We had goldfish. You wake up the next morning and they're belly up in the tank. The fish, not the kids. So control is the overriding criteria for performance measures. Well, then there are no performance measures. Congratulations, you're off the hook. Somehow we've got to get used to this idea that among the most important performance measures, we have the least control. And this is one of the reasons why it's very important to have more than one performance measure when you're thinking about performance, 3 to 5 measures taken from the upper right and lower right quadrant, to give yourself a balanced set of performance measures for a program and to get over this problem of control. Because if you insist on having controls of performance measures, well, then there are no performance measures. This is a chart that you can find on page 80 of Trying Hard is Not Good Enough, and it's a summary of the different kinds of performance measures that you find in various quadrants. So in the upper left quadrant, we typically count customers and we count activities, and you can break customers out by customer characteristics, and activities out by type of activity. In the upper right quadrant, there are a whole range of common measures that apply to many different services. So rather than start from scratch, take a look at this list and see if any of these measures apply to your program or service. Client-staff ratio, workload ratio, staff turnover rate, staff morale, a percentage of staff fully trained, worker safety, unit cost. These measures apply to many different programs. Chances are one or more of them will apply to the services that you're working on. And in addition to the common measures, we have activity-specific measures. So for each activity in the upper left quadrant, there's an activity-specific measure in the upper right quadrant that tells how well that particular activity was performed, usually having to do with timeliness or completeness, or meeting standards of one sort or another. So if the activity is number of telephone calls answered, the activity-specific measure might be the percent answered on the second ring or better. But we still haven't answered the most important question: is anyone better off? And down here, these measures almost always come in number and percentage pairs of the very same thing. Remember how we had number who graduated and percent who graduated from high school? We had number who were off of drugs and percent who were off of drugs. It's almost always the same measure, numbers on the left and percentage on the right. And it almost always has to do with one of these dimensions of whether someone is better off or not: skills and knowledge, attitude, opinion, behavior, and circumstance. Skills and knowledge we measure all the time in the education system, but you can do it in any kind of training that you do. Attitudes, we can measure attitudes about self-esteem, attitudes about drugs, attitudes about attendance. Behavior, we can look at acting out behavior or attendance behavior. Circumstance, we can look at whether people are in stable housing and have living wage jobs. And all of these measures come in one of two flavors: point in time or 2-point comparison. If we're talking, for example, about a mentoring program, we might look at the percentage of mentees with good school attendance this month, point in time. But what might be more interesting and important would be the change of good attendance from when students entered the program to when they completed the program. And so we move from here to the 7 performance accountability questions. Again, following the leaking roof thinking process, but this time we're starting with the question of who are our customers. All performance measurement systems must start with this question. And sometimes it's not obvious who your customers are. It's not uncommon for programs to have multiple customer groups. Sometimes these customer groups have competing or even conflicting interests. And my favorite example of that comes from when I worked with the Alaska Fish and Game Commission, and they have as customers the fishermen and the fish. You will never find 2 customer groups with less in common than that. So who are our customers is the starting point for performance accountability. So it may also be useful for you to distinguish between primary versus secondary customers, direct versus indirect customers, and internal versus external customers. And any of those categories that are useful to you are just fine. Question 2, how can we measure if our customers are better off? And these are the lower right quadrant performance measures, the is anyone better off measures. Question 3, how can we measure if we're delivering service well? These are the upper right quadrant measures. How well are we doing? And question 4 through 7 are the same as at the population level. Question 4, how are we doing on the most important of these measures? The most important of these measures signifies a willingness to winnow down to the 3 to 5 most important performance measures. And the how are we doing part is about creating baselines for each of these measures and telling the story behind those baselines. Question 5, who are the partners that have a role to play in doing better? Question 6, what works to do better, including no cost and low cost ideas? And question 7, what do we propose to actually do? These 7 questions are the simplest way to get from talk to action for performance accountability. And it's my view that these questions should be asked and answered at every intersection between a supervisor and a subordinate. Imagine your periodic meetings with subordinates, hand out these questions in advance. Say, we're going to spend the first 15 minutes of our supervisory conference, not the last 15 if we have time, but the first 15 minutes on your answers, the best answers to these questions. I don't expect you to get it perfect, just give it a try. And then we're going to have that discussion every time we get together for the rest of your life. That these 7 questions will be improved over time. You get better and better at answering these questions. And over time, you get better and better at using performance measure to improve services. Lots of examples of where this kind of thinking has actually worked. This example comes from North Lincolnshire in the north of England. They managed about 10,000 units of public housing, and they had a problem with vacancy rates, and they were being consistently criticized by national audits for their vacancy rates. My friend Mike Pinnock, who was assistant director at the time, brought together a group of partners, including tenants, very important to include customers in these discussions. And they were able, using RBA, they call it OBA, outcomes-based accountability, they were able to drive down vacancy rates to an acceptable level. This chart comes from Dayton, Ohio, where they had a problem with school attendance. And again, using RBA, they were able to drive up school attendance and actually improve school attendance faster than the state averages were improving at the time. Now, this is something I really want to show you. This comes from the Welsh Epilepsy Unit in Cardiff in Wales. And it is the absolute best performance measurement report I've ever seen. And I didn't create it. It was created by a woman named Ruth Jordan, who works for the National Health Service in Cardiff. And just look at what's here. This part of the one-page report describes the service of the epilepsy unit. This section next describes their customers. They show 4 headline performance measures, a data development agenda. Here they show the 4 headline performance measures in graph or baseline form. Here's the story behind those baselines, the partners that can help, and their action plan in summary form. What are we going to do to get better? Now, I want to show you 2 of these graphs in particular. The first one is percent seen by a specialist within 2 weeks. This is an upper right quadrant measure, and that was getting worse consistently over time. And bringing staff together and working on the causes behind this, they were able to drive this percentage back up again. But this is a lower right quadrant measure, the number of admissions for seizure. And this was getting better, but using RBA, they were able to drive admissions for seizure down faster than it had been declining before. So again, performance measurements used in a constructive way can actually produce measurable improvement in the performance of the program, both in terms of how well did we do it and is anyone better off. So the last thing I have to do today is to put population and performance accountability together. We've talked about both pieces. And I want to show you a page that has both population and performance on the same page. So above the double line, we have population accountability, and we have some population results: healthy births, children ready for school, self-sufficient families. And we have indicators to go with those results: rate of low birth weight babies, percent of children fully ready for kindergarten at kindergarten entry, and percentage of parents earning a living wage. Below the double line, we have performance accountability. And I picked a job training program and put it through the 4 quadrants. So in a job training program, how much did we do? Might be number of persons receiving training. How well did we do it? Could be the unit cost per person trained. But what you really want to know if you're running a job training program is the number, and more importantly, the percentage of your trainees who go on to get and keep living wage jobs. Well, now look here. Down here, we're talking about the percentage of people with a living wage job. And up at the top, we were also talking about percentage of people with a living wage job. This is not an accident. This is an important and powerful connection, because it turns out that sometimes the only difference between a population indicator and a program performance measure is the difference in scale between a customer population here and the total population up here. And what this means is that we can begin to think about what we do for our customers as our contribution to what we're trying to accomplish across the community. And that is the fundamental relationship between performance and population. It is a contribution relationship. Some funders ask you to prove your impact on the community. And it's a bogus question because most programs can't by themselves affect the community. But what you can do is you can show the effect that your program has on the customers that you serve. And whatever effect that is your de facto contribution to what you're trying to do across the community. If you want to make a difference at the community level, you need a partnership that's much broader than a single program. This also allows us to think about how we align measures that we use for programs with the measures we're using for the community. And it also allows us to avoid the mistake we've been making for 50 years or more of holding programs responsible for producing population change. We have to stop doing that. Now, we've talked about using data to report progress, and there are 2 ways to do that, which we've spend some time on today: population indicators, the population level program performance measures. But there are two other ways of measuring progress that have been around for a long time. Accomplishments. Are there any things that you have bragging rights to that you accomplished during a period of time? And perhaps more importantly, stories about individuals whose lives are better. And as you think about reporting to the public, to elected officials, to your funders, think about using all three kinds of information to report progress. And you know how you go to meetings, and the agenda is, what did you do since the last meeting? And you go around the table and everybody says what they did since the last meeting. And by that time that's over, you have a few minutes left, you don't get much done, you go away, you swear you're never going back to that meeting ever again. So next time you send a representative. But imagine if your agenda was this: new data on the curves we're trying to turn, new information about the story behind those curves. Maybe it's something you learned from research or something you learned from your son at breakfast that morning. New partners that we need to bring to the table. New information about what works, again, from research or another source. New information about financing, and given all of that, changes to your action plan and budget, and you adjourn. If it's a 10-minute meeting, that's all you had to talk about. If it's a 3-hour meeting, you had more to talk about. But every time you go through this thinking process, you go through the leaking roof thinking, and every time you do this, your action plan gets better. This would be a different kind of meeting, a more productive meeting, maybe one that people would be willing to return to over time. So, to summarize where we've been, does anyone know what this is? Well, I've gotten some good guesses over the years. Somebody guessed that this was a picture of doorknobs, and someone else thought it was a picture of bar stools, although some of these don't work so well as bar stools. But what it actually is, and I'm sure many of you know this, is the cross-section of railroad rails. And this is what the railroad system looked like in the United States, the late 19th and early 20th century. Every railroad had a different design for its railroad rails. And what that meant is that when you were shipping goods from one place to another, you had to ship them along one section of track, then unload the train, reload the train into another section of track. If you were shipping goods in Australia from Sydney to Perth, you actually had to unload and load the train 5 times. My view is that this is a picture of what the government and nonprofit sectors of our society look like today. We're all riding on different rails. We all are speaking different languages. We're all talking in ways where our work doesn't connect. And one of my hopes for RBA is that we can get past our railroad problem. And it really boils down to these 10 ideas that we've been talking about. 2 kinds of accountability: population versus performance. A language discipline that allows us to keep this all straight. Results and indicators for population, and performance measures for performance accountability. 3 different kinds of performance measures: how much did we do, how well did we do it, is anyone better off, and 7 questions that will get you from ends to means in less than an hour, which, if you remember, is about baselines and the idea of turning the curve. So, a few closing comments. If you do what you always did, you will get what you always got. This guy was talking about busing in Yonkers, New York, but it applies to the way we do this work together. If we keep doing it the same way, no one should be surprised that we keep getting the same results. And this is one of my favorite quotes from humorist Dave Barry. Never be afraid to try something new. Remember that a lone amateur built the Ark. A large group of professionals built the Titanic. And we'll end here for today. Thank you so much for your time and attention, and best wishes to all of you for the success and the important work that you all are doing. I'm looking forward to hearing about it. So thanks.